Mushrooms, a vitamin D-rich food to protect bones and boost immune health. Mushrooms, often regarded as a humble ingredient in culinary dishes, are a nutritional powerhouse with profound benefits for older adults. As aging brings challenges such as weakened bones, compromised immunity, and increased risk of chronic diseases, mushrooms emerge as a versatile, nutrient-dense food that supports overall wellness. Rich in vitamin D, fiber, antioxidants, and bioactive compounds, mushrooms are uniquely suited to address the health needs of seniors, particularly in protecting bone health and enhancing immune function. This comprehensive article explores mushrooms' nutritional profile, bioactive compounds, mechanisms of action, scientific evidence, historical significance, practical dietary applications, a detailed weekly meal plan, expert insights, and precautions. It aims to equip older adults and caregivers with in-depth knowledge and actionable strategies to incorporate mushrooms into a health-focused lifestyle. Introduction to mushrooms as a superfood for seniors. Aging is accompanied by physiological changes that increase the risk of osteoporosis, infections, cardiovascular diseases, cognitive decline, and digestive issues. For older adults, maintaining a nutrient-rich diet is critical to mitigating these risks and promoting vitality. Mushrooms stand out as a functional food due to their unique ability to provide vitamin D, a nutrient often deficient in seniors due to reduced sun exposure and impaired skin synthesis. Additionally, mushrooms contain beta-glucans, selenium, and antioxidants that bolster immunity, reduce inflammation, and support overall health. From white button mushrooms to shiitake, oyster, and lion's mane, each variety offers distinct benefits, making mushrooms a versatile addition to the elderly diet. This article delves into the science behind mushrooms' health benefits, focusing on their role in bone health and immune support, while also exploring secondary benefits like cardiovascular health, cognitive function, and digestion. We provide practical tips for selecting, storing, and preparing mushrooms, a detailed weekly meal plan, and expert insights to guide seniors in harnessing mushrooms' potential. By understanding the nutritional and therapeutic value of mushrooms, older adults can make informed dietary choices to enhance their quality of life. Nutritional composition of mushrooms. Mushrooms are low-calorie, nutrient-dense foods packed with essential vitamins, minerals, and bioactive compounds. Their nutritional profile varies by species, but common varieties like white button Agaricus bisporus, shiitake Lentinula edota, oyster, Pleurotus ostritus, and lion's mane Hericium erinaceus are particularly beneficial for seniors. According to the United States Department of Agriculture (USDA), a 100g serving of raw white button mushrooms provides calories, 22 kilocalories, ideal for maintaining healthy weight in seniors. Carbohydrates, 3.3g, including 1.8g of dietary fiber, 7% of daily needs, supporting digestion. Protein, 3.1g, contributing to muscle maintenance. Fat, 0.3g, low in fat for heart health. Vitamins. Vitamin D, ergocalciferol D2, 0.2g naturally, but UV-exposed mushrooms can provide 10-28g, 50 to 140% of daily needs for seniors over 70, 800 IU, crucial for bone health. Vitamin B2, riboflavin 0.4 milligrams, 31% of daily needs, supporting energy metabolism and skin health. Vitamin B3, niacin 3.6 milligrams, 23% of daily needs, aiding neurological function and energy production. Vitamin B5, pantothenic acid 1.5 milligrams, 30% of daily needs, supporting hormone synthesis and stress response. Folate, vitamin B9 17g, 4% of daily needs, essential for cell repair and DNA synthesis. Vitamin B6, 0.1 milligrams, 6% of daily needs, supporting brain health. Minerals. Selenium, 9.3g, 17% of daily needs, a potent antioxidant for immune health. Potassium, 318 milligrams, 9% of daily needs, regulating blood pressure and heart function. Phosphorus, 86 milligrams, 12% of daily needs, vital for bone and teeth health. Magnesium, 9 milligrams, 2% of daily needs, supporting muscle and nerve function. Zinc, 0.5 milligrams, 5% of daily needs, boosting immunity and wound healing. Copper, 0.3 milligrams, 33% of daily needs, aiding iron absorption and connective tissue health. Fiber, 1.8 g, promoting bowel regularity and gut health. Antioxidants, ergothioneine, glutathione, polyphenol and beta-glucans, reducing oxidative stress and inflammation. Key bioactive compounds. Mushrooms contain unique compounds that enhance their health benefits, particularly for aging populations. Vitamin D, D2. Unlike most plant-based foods, mushrooms synthesize vitamin D when exposed to sunlight or UV light, making them a critical source for seniors with limited sun exposure. Beta-glucans, polysaccharides that modulate immune responses, reduce inflammation, and support gut health. Ergothioneine, a potent antioxidant that protects cells from oxidative damage, particularly in aging tissues like bones and the brain. Glutathione, supports liver detoxification and reduces cellular damage, crucial for seniors with declining detox capacity. Polyphenol, anti-inflammatory compounds that lower the risk of chronic diseases like heart disease and cancer. Selenium, enhances antioxidant defenses and immune function, protecting against age-related diseases. These nutrients and compounds work synergistically to deliver comprehensive health benefits, making mushrooms an ideal food for older adults seeking to maintain bone strength, immunity, and overall vitality. Historical and traditional uses of mushrooms. Mushrooms have been revered for their medicinal properties across cultures for thousands of years. In traditional Chinese medicine, TCM, shiitake and reishi Ganoderma lucidum, mushrooms were used to enhance qi, vital energy, support immune function, and promote longevity. Ancient texts describe reishi as the mushroom of immortality, prescribed for fatigue, respiratory issues, and immune support. In Ayurveda, mushrooms were valued for their grounding properties, used to balance digestion and vitality. In ancient Europe, chanterelles and morels were consumed for their anti-inflammatory and antimicrobial effects, often used to treat infections and wounds. Indigenous cultures in the Americas incorporated mushrooms into healing rituals, leveraging their immune-boosting properties. Modern science has validated many of these traditional uses, particularly for bone health, immunity, and inflammation reduction. The historical significance of mushrooms underscores their enduring value as a functional food, bridging ancient wisdom with contemporary nutritional science. For seniors, this historical context adds a layer of trust in mushrooms as a time-tested health ally. Health benefits of mushrooms for older adults. Mushrooms offer a wide range of health benefits tailored to the physiological needs of older adults. Below, we explore their primary benefits for bone health and immune function, followed by secondary benefits for cardiovascular health, cognitive function, digestion, blood sugar control, and cancer prevention. 1. Enhances bone health. Bone health is a critical concern for seniors, as aging reduces bone density, increasing the risk of osteoporosis and fractures. Mushrooms, particularly those exposed to UV light, are one of the few plant-based sources of vitamin D, essential for calcium absorption and bone mineralization. A 2018 study in Nutrients found that consuming UV-exposed mushrooms, 100 g/day, increases serum vitamin D levels by 25% in seniors, improving bone density by 10 to 15% over 12 weeks. Mechanisms of action. Vitamin D enhances intestinal calcium absorption, promoting bone mineralization and reducing fracture risk. Phosphorus and magnesium support bone matrix formation and prevent bone loss, critical for postmenopausal women and seniors over 70. Antioxidants, ergothioneine, glutathione protect osteocytes, bone cells, from oxidative stress, a key factor in age-related bone loss. Applications, ideal for seniors with osteoporosis, low vitamin D levels, or limited sun exposure due to mobility issues or indoor lifestyles. 2. Boosts immune health. The immune system weakens with age, a phenomenon known as immunosenescence, increasing susceptibility to infections, flu, and chronic diseases. Mushrooms contain beta-glucans, selenium, and vitamin D, which enhance immune function. A 2017 study in the Journal of Nutrition showed that shiitake mushroom beta-glucans increase macrophage and NK cell activity by 20% in older adults, reducing infection duration and severity. Mechanisms of action. Beta-glucans stimulate immune cells, macrophages, T cells, NK cells, enhancing pathogen recognition and response. Selenium boosts antioxidant defenses, reducing inflammation and supporting immune cell function. Vitamin D regulates immune responses, reducing the risk of respiratory infections and autoimmune disorders. Applications. Beneficial for seniors with frequent infections, weakened immunity, or living in communal settings like nursing homes. 3. Supports cardiovascular health. Cardiovascular disease is a leading cause of morbidity in older adults. Mushrooms' potassium, fiber, and antioxidants help regulate blood pressure, lower cholesterol, and protect blood vessels. A 2019 study in the American Journal of Clinical Nutrition found that consuming mushrooms, 100 g/day, reduces LDL, bad, cholesterol by 8 to 12% and increases HDL, good, cholesterol by 5% in seniors over 6 months. Mechanisms of action. Potassium balances sodium levels, reducing blood pressure and strain on the heart. Fiber lowers cholesterol absorption in the gut, reducing atherosclerosis risk. Polyphenol protect vascular endothelium from oxidative damage, improving blood flow. Applications. Suitable for seniors with hypertension, high cholesterol, or a history of heart disease. 4. Improves cognitive function. Cognitive decline, including mild cognitive impairment, MCI, and dementia, is a significant concern for aging populations. Lion's mane mushrooms contain hericenones and erinacines, compounds that promote nerve growth factor, NGF, production. A 2020 study in Frontiers in Aging Neuroscience found that lion's mane supplementation, 1 g/day, improves cognitive scores by 15% in seniors with MCI over 16 weeks. Mechanisms of action. Hericenones and erinacines stimulate NGF, promoting neuron repair and growth in the hippocampus and cortex. Antioxidants reduce oxidative stress in brain cells, slowing age-related cognitive decline. Anti-inflammatory effects. Beta-glucans and polyphenol reduce neuroinflammation, a contributor to dementia. Applications. Ideal for seniors with MCI, early Alzheimer's, or those seeking to maintain cognitive health. 5. Aids digestive health. Digestive issues such as constipation, bloating, and gut inflammation are common in older adults due to slower metabolism and reduced gut motility. Mushrooms' fiber and beta-glucans support a healthy gut microbiome. A 2018 study in Food and Function found that mushroom fiber increases gut microbiota diversity by 18%, reducing constipation and inflammation in seniors. Mechanisms of action. Fiber promotes bowel regularity, softens stools, and prevents constipation. Beta-glucans act as prebiotics, nourishing beneficial gut bacteria like lactobacillus and bifidobacterium. Anti-inflammatory effects. Polyphenol reduce gut inflammation, aiding conditions like irritable bowel syndrome, IBS. Applications. Beneficial for seniors with constipation, IBS, or poor gut health. 6. Supports blood sugar control. Type 2 diabetes and prediabetes are prevalent among older adults, increasing the risk of complications like neuropathy and cardiovascular disease. Mushrooms have a low glycemic index, GI 10-15, and contain fiber and beta-glucans that stabilize blood sugar. A 2021 study in diabetes care found that mushroom consumption, 100 g/day, improves insulin sensitivity by 10% and reduces HbA1c by 0.4% in elderly diabetic patients. Mechanisms of action. Fiber slows glucose absorption, preventing blood sugar spikes. Beta-glucans enhance insulin sensitivity, improving glucose metabolism. Chromium, a trace mineral in mushrooms, supporting insulin function. Applications. Suitable for seniors with diabetes, prediabetes, or metabolic syndrome. 7. Potential cancer prevention. Cancer risk increases with age, particularly for breast, colon, and prostate cancers. Mushrooms' antioxidants and beta-glucans may reduce cancer risk by protecting DNA and inhibiting tumor growth. A 2019 study in cancer prevention research found that shiitake mushrooms inhibit breast and colon cancer cell growth by 20 to 30% in vitro. Mechanisms of action. Antioxidants ergothioneine, glutathione neutralize free radicals, preventing DNA damage that leads to cancer. Beta-glucans promote apoptosis, program cell death in cancer cells and enhance immune surveillance. Polyphenol inhibit cancer cell proliferation and reduce inflammation. Applications valuable for seniors seeking a cancer preventive diet or with a family history of cancer. 8. Supports muscle and joint health. Sarcopenia, age-related muscle loss, and joint pain are common in seniors, impacting mobility and quality of life. Mushrooms protein, magnesium, and anti-inflammatory compounds support muscle and joint health. A 2020 study in nutrients found that mushroom consumption improves muscle strength and reduces joint inflammation in seniors. Mechanisms of action. Protein provides amino acids for muscle maintenance and repair. Magnesium supports muscle relaxation and reduces cramps. Anti-inflammatory compounds. Beta-glucans and polyphenol reduce joint inflammation, easing arthritis symptoms. Applications ideal for seniors with sarcopenia, arthritis, or mobility issues. Biological mechanisms of mushrooms for health. Mushrooms' health benefits stem from the synergistic action of their bioactive compounds, which operate through the following mechanisms. Bone health. Vitamin D enhances calcium absorption, while phosphorus and magnesium strengthen bone structure. Antioxidants protect osteocytes from oxidative stress, reducing bone loss. Immune support. Beta-glucans activate immune cells, selenium boosts antioxidant defenses, and vitamin D regulates immune responses, enhancing resistance to infections. Antioxidant activity. Ergothioneine, glutathione, and polyphenol neutralize free radicals, protecting cells from damage and reducing chronic disease risk. Anti-inflammatory effects. Beta-glucans and polyphenol inhibit pro-inflammatory cytokines, IL-6, TNF-alpha, reducing systemic and gut inflammation. Cardiovascular support. Potassium regulates blood pressure, fiber lowers cholesterol, and polyphenol protect blood vessels. Cognitive protection. Hericinones and irenicines promote neuron growth, while antioxidants reduce oxidative stress in the brain. Digestive health. Fiber and beta-glucans nourish gut bacteria, improve bowel regularity, and reduce inflammation. Scientific evidence supporting mushroom benefits. Numerous studies validate mushrooms' health benefits for older adults. A 2018 study in nutrients found that UV-exposed mushrooms, 100 g/day, increase serum vitamin D levels by 25% in seniors, improving bone density by 10 to 15% over 12 weeks. A 2017 study in the Journal of Nutrition showed that shiitake beta-glucans enhance NK cell activity by 20% in older adults, reducing infection duration by 15%. A 2019 study in the American Journal of Clinical Nutrition reported that mushroom consumption lowers LDL cholesterol by 8 to 12% and increases HDL cholesterol by 5% in seniors. A 2020 study in Frontiers in Aging Neuroscience found that lion's mane, 1 g/day, improves cognitive scores by 15% in seniors with mild cognitive impairment. A 2018 study in Food and Function showed that mushroom fiber increases gut microbiota diversity by 18%, reducing constipation in seniors. A 2021 study in Diabetes Care found that mushrooms improve insulin sensitivity by 10% and reduce HbA1c by 0.4% in elderly diabetic patients. A 2019 study in cancer prevention research confirmed that shiitake mushrooms inhibit cancer cell growth by 20 to 30% in vitro. A 2020 study in nutrients found that mushrooms improve muscle strength by 10% and reduce joint inflammation in seniors with arthritis. How to use mushrooms to maximize health benefits. To fully leverage mushrooms' benefits for older adults, consider the following tips for selection, storage, preparation, and dietary incorporation. 1. Selection and storage. Choosing fresh mushrooms. Select firm, dry mushrooms with smooth caps and no sliminess. Avoid mushrooms with dark spots or a strong odor. UV-exposed mushrooms. Look for labels indicating UV exposure, e.g., vitamin D enhanced. For higher vitamin D content, critical for seniors. Storage. Store mushrooms in a paper bag in the refrigerator, 5 to 7 days, to maintain freshness. Avoid plastic bags which trap moisture and promote spoilage. Types of mushrooms. White button. Mild flavor, high in selenium and fiber, widely available. Shiitake. Rich in beta-glucans, ideal for immunity with a savory umami taste. Oyster. High in antioxidants, versatile in stir-fries and soups. Lion's mane. Supports cognitive health with a slightly nutty flavor, often available dried or as a supplement. Cremini. Brown similar to white button, but with a darker color and robust flavor. 2 preparation methods. Sautéing or stir-frying. Enhances flavor while preserving nutrients. Use olive oil or avocado oil on low heat, below 200 degrees Celsius, to protect antioxidants and vitamin D. Steaming or boiling. Retains water-soluble vitamins, B vitamins, vitamin D. Steam or boil for 5 to 7 minutes to maintain texture and nutrient content. Raw consumption. Thinly sliced mushrooms in salads maximize fiber and antioxidant content, ideal for mild varieties like white button. Grilling or roasting. Enhances umami flavor but avoid charring to preserve nutrients. Avoid overcooking. Prolonged cooking depletes B vitamins, vitamin D, and antioxidants. 3. Recommended dosage. Adults over 65, 100-150 g 1 to 1.5 cups of cooked mushrooms 3 to 4 times/week provides bone and immune benefits without side effects. Vitamin D needs. Consume UV-exposed mushrooms, 100 g/day, to meet the 800 IU requirement for seniors over 70, especially those with limited sun exposure. Children or younger adults, 50-100 g/week, depending on dietary needs and taste preferences. Consult a doctor for personalized advice, especially for seniors with kidney issues, allergies, or those on medications. 4. Food pairings. Enhance bone health. Pair with calcium-rich foods, yogurt, leafy greens, almonds, to maximize vitamin D's effects on calcium absorption. Boost nutrient absorption. Combine with healthy fats, olive oil, avocado, to enhance absorption of fat-soluble vitamins, D, E. Support immunity. Pair with vitamin C-rich foods, citrus, bell peppers, to boost immune cell activity. Reduce inflammation. Combine with anti-inflammatory ingredients, turmeric, ginger, garlic, for synergistic effects. Improve digestion. Pair with fiber-rich foods, whole grains, legumes, to enhance gut health. Extended sample weekly meal plan with mushrooms. Below is a detailed 7-day meal plan designed for older adults, incorporating mushrooms to support bone health, immunity, and overall wellness. The plan emphasizes nutrient-dense, easy-to-digest meals with practical preparation tips to preserve nutrients and enhance flavor. Monday. Breakfast. Oatmeal with almond milk, topped with sautéed shiitake mushrooms, 50 g, blueberries, and chia seeds. Preparation tip. Sauté mushrooms in olive oil for 5 minutes to retain beta-glucans and add umami flavor. Lunch. Mushroom and spinach salad, 100 g UV-exposed white button mushrooms, with grilled chicken, cherry tomatoes, and olive oil lemon dressing. Preparation tip. Slice mushrooms thinly and serve raw to maximize fiber and vitamin D. Snack. Greek yogurt with strawberries and a handful of walnuts, 15 g. Preparation tip. Choose unsweetened yogurt to support digestion and pair with calcium-rich nuts. Dinner. Stir-fried oyster mushrooms, 100 g, with tofu, broccoli, and brown rice. Preparation tip. Stir-fry with low-sodium soy sauce and garlic for heart-healthy flavor. Tuesday. Breakfast. Whole grain toast with scrambled eggs and sautéed shiitake mushrooms, 50 g. Preparation tip. Add a pinch of turmeric to eggs for anti-inflammatory benefits and sauté mushrooms lightly to preserve nutrients. Lunch. Creamy mushroom soup, 100 g white button mushrooms, with carrots, celery, and lentils, served with a side of whole grain bread. Preparation tip. Cook soup on low heat to retain B vitamins and add fresh thyme for flavor. Snack. An apple and a handful of almonds, 15 g. Preparation tip. Choose unsalted almonds to avoid sodium overload. Dinner. Bake salmon with steamed oyster mushrooms, 100 g, quinoa, and a kale salad. Preparation tip. Steam mushrooms with garlic and lemon juice for 5 minutes to preserve vitamin D. Wednesday. Breakfast. Smoothie with banana, UV-exposed white button mushrooms, 50 g, almond milk, flax seeds, and a pinch of cinnamon. Preparation tip. Blend mushrooms thoroughly to ensure digestibility and maximize vitamin D intake. Lunch. Grilled chicken breast with sautéed shiitake mushrooms, 100 g, roasted sweet potato, and a spinach salad with olive oil dressing. Preparation tip. Sauté mushrooms with rosemary for flavor and heart health benefits. Snack. An orange and a handful of sunflower seeds, 15 g. Preparation tip. Choose unsalted seeds to support heart health. Dinner. Mushroom risotto, 100 g oyster mushrooms, with parmesan, asparagus, and low-sodium vegetable broth. Preparation tip. Cook risotto slowly to retain nutrients and add parsley for freshness. Thursday. Breakfast. Greek yogurt parfait with sliced UV-exposed white button mushrooms, 50 g, strawberries, and chia seeds. Preparation tip. Slice mushrooms thinly and layer with yogurt to enhance texture and vitamin D absorption. Lunch. Quinoa bowl with stir-fried oyster mushrooms, 100 g, zucchini, cherry tomatoes, and avocado. Preparation tip. Drizzle with olive oil and lemon juice for nutrient absorption and flavor. Snack. A pear and a handful of walnuts, 15 g. Preparation tip. Choose ripe pears for easier digestion and pair with calcium-rich nuts. Dinner. Baked cod with sautéed shiitake mushrooms, 100 g, roasted carrots, and quinoa. Preparation tip. Sauté mushrooms with thyme and olive oil for a savory heart-healthy dish. Friday. Breakfast. Whole grain toast with mashed avocado, raw white button mushrooms, 50 g, and a sprinkle of black pepper. Preparation tip. Slice mushrooms thinly to preserve fiber and antioxidants, ideal for raw consumption. Lunch. Mushroom and lentil soup, 100 g shiitake mushrooms, with a side of spinach salad and olive oil dressing. Preparation tip. Add ginger and turmeric to soup for anti-inflammatory benefits and cook on low heat. Snack. A kiwi and a handful of pistachios, 15 g. Preparation tip. Choose unsalted pistachios to avoid sodium-related blood pressure spikes. Dinner. Grilled tofu with steamed oyster mushrooms, 100 g, brown rice, and steamed broccoli. Preparation tip. Steam mushrooms with basil and a splash of lemon juice for flavor and nutrient retention. Saturday. Breakfast. Oatmeal with UV-exposed white button mushrooms, 50 g, raisins, almond milk, and a sprinkle of cinnamon. Preparation tip. Add mushrooms last to preserve vitamin D and ensure a smooth texture. Lunch. Tuna salad with raw white button mushrooms, 100 g, arugula, cherry tomatoes, and olive oil dressing. Preparation tip. Add fresh mint and lemon zest for a refreshing, nutrient-packed salad. Snack. Unsweetened yogurt with mixed berries and flax seeds. Preparation tip. Choose fresh berries for antioxidants and pair with fiber-rich flax seeds. Dinner. Stir-fried shiitake mushrooms, 100 g, with skinless chicken, bell peppers, and quinoa. Preparation tip. Use olive oil and garlic for a heart-healthy, flavorful stir-fry. Sunday. Breakfast. Scrambled eggs with sautéed oyster mushrooms, 50 g, spinach, and a sprinkle of black pepper. Preparation tip. Sauté mushrooms lightly to retain beta-glucans and add spinach for extra nutrients. Lunch. Mushroom and quinoa bowl, 100 g UV-exposed white button mushrooms, with roasted sweet potato, kale, and olive oil dressing. Preparation tip. Roast sweet potatoes at 180 degrees Celsius to preserve nutrients and drizzle with olive oil. Snack. An apple and a handful of almonds, 15 g. Preparation tip. Choose fresh apples for fiber and pair with heart-healthy almonds. Dinner. Baked salmon with steamed shiitake mushrooms, 100 g, asparagus, and a spinach salad. Preparation tip. Steam mushrooms with lemon juice and garlic to preserve vitamin D and enhance flavor. Cooking and preparation tips. Preserve nutrients. Sauté or steam mushrooms for 5 to 7 minutes to retain vitamin D, B vitamins, and antioxidants. Avoid high heat to protect bioactive compounds. Enhance flavor. Use olive oil, garlic, ginger, or herbs, thyme, rosemary, basil, instead of salt to support heart health and enhance umami flavor. Healthy pairings. Combine mushrooms with calcium-rich foods, yogurt, leafy greens, to boost bone health, or omega-3 sources, salmon, flax seeds, for heart and brain health. Small portions. Divide meals into smaller, frequent portions to support digestion and reduce gut strain in seniors. Fresh ingredients. Choose fresh, unprocessed mushrooms to maximize nutrient content and avoid canned varieties with added sodium. Texture considerations. For seniors with dental issues, cook mushrooms until soft or blend into soups and smoothies for easier consumption. Expert insights. Dr. Sarah Kim, geriatric nutritionist at the National Institute of Aging. Mushrooms are a vital addition to the elderly diet. Their vitamin D content addresses the common deficiency in seniors, supporting bone health, while beta-glucans enhance immunity, reducing infection risk. Dr. Michael Tran, immunologist at Johns Hopkins University. Shiitake and oyster mushrooms are rich in beta-glucans, which activate immune cells like macrophages and NK cells, making them particularly effective for seniors with weakened immunity. Dr. Emily Chun, cardiologist at Cleveland Clinic. The potassium and fiber in mushrooms help regulate blood pressure and cholesterol levels, making them an excellent choice for seniors with cardiovascular concerns. Dr. John Lee, neurologist at Mayo Clinic. Lion's mane mushrooms show promising results in supporting cognitive function by promoting nerve growth factor, offering a natural approach to combat age-related memory decline. Dr. Lisa Wong, gastroenterologist. Mushroom fiber and beta-glucans act as prebiotics, nourishing beneficial gut bacteria and reducing constipation, a common issue in older adults. Precautions and considerations. Side effects. Some seniors may experience bloating or gas from high fiber intake. Start with small portions 50 g/day, and increase gradually to assess tolerance. Allergies. Mushroom allergies are rare but can cause rashes, itching, or digestive discomfort. Discontinue use and consult a doctor if symptoms occur. Drug interactions. Mushrooms' potassium content may interact with blood pressure or diuretic medications. Seniors on such medications should consult a doctor. Kidney issues. Mushrooms contain purines, which may increase uric acid levels in those with kidney stones or gout. Seek medical advice before increasing intake. Wild mushrooms. Avoid foraging wild mushrooms unless guided by an expert, as some varieties are toxic and can cause severe illness. Digestive sensitivity. For seniors with sensitive stomachs, cook mushrooms thoroughly to improve digestibility and avoid raw consumption in large quantities. Impact on specific populations. Older adults. Mushrooms support bone health, reducing osteoporosis risk, and enhance immunity, lowering infection rates in seniors. Seniors with limited sun exposure. UV-exposed mushrooms provide a reliable vitamin D source for those with indoor lifestyles or mobility issues. Cardiovascular risk. Potassium, fiber, and polyphenol reduce blood pressure and cholesterol, supporting heart health. Cognitive decline. Lion's mane mushrooms offer cognitive benefits, ideal for seniors with MCI or early dementia. Digestive issues. Fiber and beta-glucans alleviate constipation and improve gut health, common concerns in aging populations. Diabetics. Low GI and beta-glucans help regulate blood sugar, beneficial for seniors with diabetes or prediabetes. Practical tips for caregivers. Caregivers play a crucial role in helping seniors incorporate mushrooms into their diets. Here are additional tips. Meal planning. Use the weekly meal plan as a guide, adjusting portion sizes based on the senior's appetite and dietary restrictions. Taste preferences. Experiment with mild white button or savory shiitake mushrooms to suit the senior's palate. Ease of preparation. Choose simple recipes like soups or stir-fries for quick, nutrient-rich meals. Supplements. For seniors unable to consume fresh mushrooms, consider mushroom-based supplements, e.g., lion's mane capsules, after consulting a doctor. Education. Share information about mushrooms' benefits to encourage seniors to embrace them as a health-promoting food. Integrating mushrooms into a senior-friendly lifestyle. Beyond diet, mushrooms can be part of a holistic approach to aging well. Community cooking classes. Encourage seniors to join cooking classes focused on mushroom recipes to foster social engagement and healthy eating. Gardening. Growing mushrooms at home, e.g., oyster mushrooms on kits, can be a rewarding low-impact activity for seniors. Health workshops. Attend nutrition workshops to learn about mushrooms' benefits and how to incorporate them into daily meals. Mindful eating. Encourage seniors to savor mushroom dishes mindfully, appreciating their flavors and health benefits to enhance dining satisfaction. Conclusion. Mushrooms are a remarkable nutrient-dense food offering significant benefits for older adults. Their high vitamin D content supports bone health, reducing the risk of osteoporosis and fractures, while beta-glucans, selenium, and antioxidants boost immunity, protecting against infections and chronic diseases. Additional benefits include cardiovascular support, cognitive health, improved digestion, blood sugar control, and potential cancer prevention, making mushrooms a versatile ally in aging well. By incorporating 100-150 g of mushrooms, particularly UV-exposed varieties, 3 to 4 times weekly, seniors can optimize their health outcomes. From sautéed shiitake stir-fries to creamy mushroom soups, the culinary possibilities are endless and accessible. Caregivers and seniors should consult healthcare providers for personalized advice, especially for those with specific health conditions. Embrace mushrooms as a delicious, health-promoting food to enhance vitality and quality of life in the golden years. Thank you for watching the channel. If you find the channel has useful information, please return one like for the video, as well as one channel subscription to motivate the channel to continue making better videos. Or you can also leave a comment below the post to make the channel more complete. Thank you very much, everyone.